Anterior cruciate ligament injuries in dogs are one of the most commonly seen orthopedic injuries. There are multiple contributing factors, including activity levels, breed, age, and obesity. In my opinion, eating processed diets all their life is the greatest contributing factor. When I first met Melvin in 2015, he weighed 93.5 pounds. His pet parent was open to helping him lose weight and eat a more sustainable diet. After converting Melvin to a raw diet with probiotics and specific herbs, Melvin lost 21.5 pounds. He lost a dog. On October 16, 2016, Melvin was playing with his little brother when he ruptured his right anterior cruciate ligament and tore the meniscus. He was immediately non-weight bearing, as you can see from the video. Due to financial restrictions, surgical repair was not an option. Instead, we developed a protocol utilizing magnetic resonance, MRM laser therapy, chiropractic adjustments, infrared sauna, and CBD oil. By day 10, he was beginning to weight bear on his right hind leg. Here you can see Melvin starting to toe touch. Four weeks later, Melvin was weight bearing with a mild to a moderate limp. Four more weeks later, and Melvin was sound. In 10 weeks, he had returned to normal function without the use of steroids or surgery. And we've had several success cases since Melvin. Another 30 days later, Melvin is still playing and acting normal. It is now almost 2 years later, and Melvin is still fully functional on his right leg. Now let's hear from Melvin's mom.
My name is Amanda Graves, and this is my 9-year-old American Bulldog, Melvin. On October 17th, Melvin tore his meniscus and his ACL playing in the backyard with our puppy. Due to the extensive surgery, it was not an option for me. Dr. Siegel suggested that we use a magnosphere therapy to help with the pain and healing process. Our goal was that although Melvin may not have full use of his leg, if he was pain-free, he would still have a good quality of life. However, after just 2 sessions in the magnosphere, I noticed Melvin was starting to put weight on his leg when walking. After a few more weeks of the magnosphere, 1 or 2 times a week, Melvin was putting more and more weight on his leg. 6 to 8 weeks later, Melvin had full function of his leg. He is putting all of his weight on it. He is running and he's swaying, just like he did prior to the injury. I know that if it was not for the magnosphere, Melvin would not have healed nearly as quickly as he has. I would highly recommend to anybody that is facing the same injuries in their animals that I faced with Melvin to try the magnosphere therapy over surgery.